All right, so today I'm going to introduce you another skill, and this is called foot care. Let's first begin with what my supplies are. So I have two small towels, there are your regular washcloths, and two big towels, the regular bath towels. So immediately when you're doing a wet activity, the first big towel will be your table barrier. And of course the other ones I'm going to show you how to use them next. Also, I have here a soap. This one's going to be a lotion. This is the only skill that requires lotion. And also a basin and a pair of gloves. And I'm ready to go. Be aware that you're going to prepare this before you start your skill, so that you don't have to fumble and you have to rattle looking and searching and rummaging for your supplies. So that it is prepared just like this, set it out right next to your patient, and then you can begin. Proctor, I'm ready to get started. And then you go, I already washed my hands, knock, knock, knock. Good morning, Miss Gina. My name is John, and I am here, your CNA, to help you with the foot care. Is that okay if I come in?
Yes.
Okay, and then I'm gonna go ahead and come out to Miss Gina. Miss Gina, it's time for your foot care. I'm just gonna check your wristband and confirm this is my patient. I've definitely closed the curtain for privacy, and then I make sure that the wheels are locked, and they are, and the bed is on a comfortable height. I'm gonna get started here with my supplies. Okay, first thing that I'm gonna do is I'm gonna make sure that it's completely within my comfortable height or working height, working level. So be aware that in this skill, that if you forgot to close the curtains, similar to bed bath, dressing, catheter care, perineal care, if you missed and did not close the curtain, you could potentially fail, because that will include exposure of body parts of Miss Mary or your patient, in this case, Miss Linda. So what I'm gonna do next is I'll have to come down here. Miss Linda, let's get started. Whatever your name is, I think it was Gina. So you will have to expose only one leg. All right, in this case, he was wearing a pants, so I'm just gonna go ahead and pull it up a little bit. That should be about okay. I'll bring this closer to me so to minimize doing a lot of walking. Okay, still without gloves, what I'm gonna do is I will place this underneath her foot. So I'll just casually unfold and place it underneath her leg. So be aware that the way I hold my patient is like this, not like that. So support her under her lower leg. Okay, and then at this point, I'm ready to get started. So what I'm gonna do is I will first test the water. Check for the water temperature. It is 105. Miss Linda, can you please check as well? He said it's okay, perfect. And then I'll have to place it back here. And that's the time that I can put my gloves on. So you can't test the water with your gloves on. Definitely test water first and then gloves on. And this is what I'm doing now. Okay, so as soon as I have my gloves on, what I'm gonna do next is to get first towel into the water, wring that, have some soap, place it aside, and then it's ready. Then what I'm gonna do next is I'll bring it down here on Miss Mary's leg. Miss Mary, Miss Linda, I'm just gonna have to raise your foot like this, and then it is soaking, it is rinsing. What's gonna happen next is with my towel that already has soap, lather it a little bit, and then I'll bring this up above the water surface, and then I'll begin to scrub all surfaces, wash all surfaces in between the toes, in the back here, and a little bit here in the calf area. As soon as I'm done, I can place it back to the water surface and have this to the soiled linen basket. Okay, now what I'm gonna do next is I will rinse. Remember what I did? I soap, and now it's gonna be rinsing. So to rinse that, just casually splash water onto the surface of the foot of your patient, and now making sure that it is completely rinsed off, and then just do it like this. Place it back into the surface of the bed. This water basin is now going to be back on a table. Then I'm going to dry the leg and the foot. So what I'm going to do is use this the same towel that I used earlier to protect or to support the leg. So now it is dry. I'll just have to put it back like that. Next thing what I'm gonna do is apply lotion onto my palm, which is gloved hand. Put it back here, spread it a little bit, and then spread it just to the side. And you have to say this, excluding between the toes. You have to say that. The proctor needs to hear you say that. And then the last one that I'm going to use is the small towel. Its job is to just basically wipe off the excess lotion. So we don't want the super amount of lotion on the foot of Miss Mary. So wipe it off and then put it in a soil linen basket. Okay, so after this, I'm ready to put away my supplies. What I'm going to do first is raise this a little bit and toss it in the soil linen basket as well. All right, so I'll have to instruct Miss Patient, Miss Mary. I have to put away my supplies. When I'll be back, I'll cover you up. Here's why. I cannot touch these items here with my gloves, so I have to leave it alone to let it air dry. Okay, so on my way out, I will just have to mention to my patient, Miss Patient, you have access to cold light. I'll just have to put this away, wash, rinse, dry, and put in the designated area. Come back, just pour the towels. I'm gonna have to just fold it like this, away from my uniform, make sure to put in the soil linen basket. And then I'm done. I just have to remove my gloves. Be aware that you should use the proper way of removing gloves. Dirty to dirty, clean to clean, and toss it to the trash can. And then I will make sure to sanitize my hands. All right, Miss Linda, I am back, and I'm going to just put your covers back. Definitely when you put your cover back, you just have to do your toe pleat. What is toe pleat? Because there's so much pressure on the toes, you just have to release it. Pow. And make sure the patient is in the center of the bed, not on the side or so. Okay, Miss Linda, we're done for today's foot care session, and I hope you're feeling more refreshed and ready for the day. I have to make sure that you have access to cold button is right here, and then the bed is now adjusted to the low safest position, and you have the wheels are still locked. And you need a magazine or TV remote. You can watch TV or a book or an iPad. A book?
Yes.
Okay, so here is your book. There it is. I'm gonna place it here so you can easily access. Well, what about the curtains? You want to keep closed or do you want me to open for you?
Open, please.
Open? Okay, I'll have to open it for you. In the testing center, they have similar to that kind of curtains. Sometimes they don't have it, but as long as you verbalize that you're doing something about the curtains, that you give your points. Okay, well then, Ms. Linda, we're done for today, and I'm gonna go ahead and wash my hands and document. Proctor, skill complete.
Okay, thank you.